Hello everybody and welcome to the Carlin Cymru revision sessions. The session this evening will focus on GCSE health and social care and will be presented by Mrs Lewis from e-sgol Cymru. The session will last around 45 minutes where Mrs Lewis will run through the relevant content. If you have any questions during this session, please use the Q&A section and we'll do our best to answer your questions. You'll see that there's a hyperlink in the Q&A section. If you're happy to leave your name and email address, we'd love to keep in touch with you so that we can send you information about our future events. You can click on that link at any time during this session. Today's session will be recorded and the recording and any relevant resources will be uploaded to the e-sgol website shortly after this session on the Carlin Cymru tab. Thank you very much, Mrs Lewis. It's over to you.
Thank you very much. Okay, so this evening we will be continuing from session 2, which was factors that affect our health and well-being. The beginning of tonight's session will begin with environmental factors that affect our health and well-being, and then we'll be moving on to growth mindset, mindfulness, resilience and active participation. Some of you may be aware, but yesterday the WJEC released information regarding the external examination on the 24th of May. They've released information with regards to the higher tariff questions, and there are a list of topics that are likely to be questioned in the summer. So if you haven't yet gone over to that website, I would suggest that you have a look to help with your revision. Okay. So we're going to begin tonight's session with a question, okay, which we will revisit in about 10 minutes. So Tanya lives in a small damp flat. She eats food high in fat. Tanya left school without any qualifications. Explain how living in a small damp flat will affect Tanya's growth and development. Okay. So at the moment, perhaps you can think of a couple of answers in terms of why living in a small damp flat could affect Tanya's growth and development. But the hope is, when we revisit this now in 2 or 3 slides, that you will have far more confidence in the approach to the question. Okay. So first of all, just to make you aware, the environmental factors include our housing conditions. Okay, so where we actually live and our home in terms of warmth, how comfortable it is, whether it's damp, and also the location. And we will also be looking at the availability of health and social care services and childcare services and how they can affect our health and well-being. And then obviously air pollution. Okay. So I've seen several examples of this question on different specifications over the years, where you are asked with regards to the negative effects of poor housing conditions on growth and development. Okay, you were normally given a case study where they will ask a certain person of a certain age, and then obviously your answers need to be specific in terms of perhaps the development of that individual, for example, a child compared to an adult. Okay. Now, I would always approach a question like this in terms of, let's talk about the 4 areas of development. Okay, so this perhaps should be ingrained in yourselves now in terms of what you're studying in school and how your teachers are approaching revising questions like this. Okay, so first of all, we would look at the physical aspects. So maybe more prone to illness, maybe you're in pain, maybe you feel very cold, itching, perhaps itching of the skin, itching of the eyes, just because of the irritation in terms of your house is not in a very good condition. Intellectually then, maybe there are a lack of resources or entertainment at home. So for example, you might not have access to books, to the internet, may not have a computer, may not have pens and pencils, just because perhaps that's not a priority in the house. Emotionally then, you would feel perhaps quite sad and embarrassed, angry, frustrated or bored because of the situation that you're living in. You may feel quite anxious in terms of when is the situation going to improve. But then socially, perhaps you'll have less friends because you're not asking people to come over to your house. No sleepovers, for example, with younger children or teenage friends. There's less interaction involved then, just because there's nobody coming to your property, and at times you could possibly then feel lonely and less engaged with activities that happen at home. Okay. We can also have a question based on the reverse. Okay, so what if we live in a house and it's in good condition and we have many resources, we feel very comfortable? How could this positively affect our growth and development? Okay, so obviously we would be very warm and perhaps healthy because of how we're eating. Our hygiene levels would be better. We would feel comfortable. Perhaps less chance of illnesses, not as ill, wouldn't affect attendance in school or our workplace. Okay. Obviously there could be more resources there in terms of books, pens, papers, internet, computers, many devices perhaps for every person within the house. Learning then obviously would be far easier, and we would be able to participate in more entertainment activities. Okay. We would feel quite proud of where we live, happy, not so stressed, quite relaxed. We feel that we're contributing well to society, so we have more self-worth and self-confidence. Okay. Socially then, maybe you could look at it in terms of, well, everybody comes to your house, there's many celebrations, you have plenty of sleepovers, Christmas and Christmas and birthdays are celebrated. You entertain on a regular basis, and because of that then you have better interaction, more friends, company, don't feel so lonely, and are obviously happy within your social circle. Okay. If we look then at the availability of services, now the availability of services within the UK should be fair because of our NHS. Okay. However, this can depend on perhaps where you're living and how close you are to those facilities. Okay. When you think of us using services throughout our lives, there are many services available to every individual. So, for example, our GPs, hospitals and social services. And obviously the positive aspects in terms of how this helps our growth and development is we can promote a healthy way of living. So for example, maybe I am carrying excess weight, I visit my GP surgery and they would offer advice then in terms of how I could promote my own individual health through perhaps more exercise and eating healthier. Okay. Maybe they need to treat symptoms depending on what your problem is. You have an opportunity to learn through play, especially through our childcare services, and how some of these then are funded by the government to ensure that every individual has an opportunity to play prior to attending school at 3 years of age. It helps parents who are in danger or perhaps would harm themselves or others to gain access to support, and perhaps that can be done sooner rather than later. It also protects individuals in terms of we have obviously immunisation programmes throughout our life. We have obviously the flu vaccines, the most recent COVID vaccines is a good example to use there. We can also think of our screening programmes, and the screening programmes are obviously offered to certain individuals at certain ages through their life stage. And also dependent on your gender. Okay. And hopefully as well that our individuals who have any form of disability feel that they are getting the necessary support even at a young age and an old age. Okay, so this is really how our health and social care services and childcare services can contribute to our growth and development. Okay. Now, there's a long list of health and social care and childcare services. I'm currently in school at the moment. My year 10s are actually researching the different roles and services that exist. And what I've asked them to do is just tell me how those roles contribute to growth and development. And obviously that depends on the actual role of the person in terms of what age category or life stage that is appropriate to. Okay, so that is something important perhaps that you need to look at in terms of, are you aware of a number of different jobs that actually exist and what their actual role contributes to. Okay, unfortunately, in terms of accessing services, some individuals feel or perhaps they are faced with barriers whilst accessing these services. Okay, so some of these barriers are physical barriers. So maybe they cannot physically access the service for perhaps mobility issues. Maybe they're in a wheelchair, maybe they're elderly, and they can't actually walk that far. Okay, so these individuals then tend not to use services as much as they need to, and obviously that's a detriment to their health and well-being. Okay, so what's important for us as services to ensure then is these individuals who have perhaps physical barriers, is it possible to provide our care to them at a community level and their homes then, so they obviously can continue to grow and develop as well as others. There are some psychological barriers, so people's attitudes towards services. Many people feel that they couldn't possibly be ill, it could never apply to them, and also perhaps fear. They've had a bad experience in the past and they've decided that they no longer want to attend that service for whatever reason. Okay. There are financial barriers. Obviously, the NHS being in the statutory sector, that should never be an issue. However, if somebody would like to access care quicker by the private services, then they might not be able to fund that. Okay. We also have to consider travelling costs to these locations in terms of petrol, in terms of public transport, parking, maybe catching a taxi. And for some individuals who have to take maybe a morning or afternoon off work and they don't have perhaps such flexibility if they're self-employed. Okay. Geographical location then is based on where's the service base compared to your home. Okay, so for example, if you live on a farm in a rural area, okay, then distance to attend a service might be very inconvenient to you. Maybe the public transport doesn't run as often. You have an appointment time, and maybe this means that you're hanging around for maybe an hour before your appointment and an hour afterwards, so it takes even longer, a larger amount of time during your day. And also, maybe the actual service that you require to use is very specialised, therefore you have to travel a further distance than maybe your local hospital or your closest hospital. Okay. There are some language and cultural barriers. Okay, and fortunately, perhaps for us being able to speak English, we don't come across many language barriers. Some individuals who obviously would use Welsh as a first language may feel that they can't be provided with a service through the media of Welsh, and that is quite frustrating and a big barrier to those individuals. It's important for us to understand perhaps the beliefs and different religions that exist to make sure that these barriers are not present, and to make sure everybody feels equal in terms of receiving care from these services. And in some instances, we have resources which are barriers to us in terms of staffing, maybe funding for certain services. Maybe in an area that you live, there has been a certain service, however, that's been cut just because of financial constraints. Okay. Now, these barriers are important for us to understand. Okay, as much as there are services out there, not every individual can use these services. And obviously, this slide hopefully will just make you aware of some of the complications that certain individuals encounter. Okay. Air pollution then is obviously an environmental factor that can contribute towards our health and well-being. Okay, so first of all, we need to ensure that we understand what air pollution is. Okay, so where air pollution can come from, and also then the effects of air pollution on our growth. So think of vehicles. Okay, think of perhaps buildings. Okay, large factories, and with a lot of pollution thrown into the air, and then why this is a concern to us in terms of how fuels are used. Okay, so you can obviously see the poster as well that's on the screen. Okay, there are some short-term effects there and long-term effects. You definitely need to be aware of some of these. Some of them are pretty common sense, okay, but obviously we can die if we're exposed to air pollution on a regular basis. We could have respiratory diseases or problems with breathing. Perhaps we have a wheezy chest, perhaps we suffer from asthma. We have cardiovascular diseases, so more in terms of the oxygen in the blood and how that is distributed throughout the body, and not as pure oxygenated blood as we would like. Okay, we perhaps get tired, we have headaches, and we worry a lot about the situation that we're in. Itching of the eyes and nose, damage to reproductive organs, and perhaps at that time we do not recognise that this is an effect, that this might come later in life when individuals decide to start a family. There's obviously damage to the blood and the liver then in terms of your cardiovascular disease, possibly damage to your nervous system, and the effects then are obviously something that can be with us the rest of our lives. There are certain areas within Wales where air pollution levels are very high, and there's a place called Hafod, which isn't too far away from where I teach, and how a community of houses there have actually been demolished because of the air pollution levels on that road. Okay, so this does definitely exist within Wales. It is a problem, and obviously these are some of the effects that air pollution causes to us. Based directly on this slide then, and I have an examination question. So Bronwyn lives near a busy road. This causes high levels of air pollution. Name one condition caused by air pollution. Okay, so there could be several, there could be several examples in your answer here. So I'm just going to go back off that so I can go back to where I was. And what we could look at here is asthma. Okay, we have an issue with this. We couldn't be asthma is one answer. We could say stroke is a condition caused by air pollution, lung cancer, and then a respiratory disease could be COPD. Okay, so this is just a one marker, but it is important perhaps you have conditions that can be caused by air pollution. Okay, just going to revisit then the question that we saw a couple of minutes ago, maybe 10 minutes ago. In terms of Tanya living in the small damp flat. Okay, she eats food high in fat. Okay, Tanya left school without any qualifications. We have two facts there really that are not helping us with the question, so we need to kind of eliminate those facts for now, and we could look then at how this is going to affect Tanya's growth and development. Okay, so possibly some of you were thinking that she could be suffering from a number of health problems associated with living in a small damp flat. So again, we could be looking at any respiratory problems. Okay, maybe she has, or she suffers with illness more than others. She could have a cough. She could be scratching or itching her skin and eyes because of the irritation of the dampness. She could be feeling very cold. She could have a low immune system. And not being able to fight off bacteria very effectively. Okay, so those I would say are the physical effects on Tanya's growth and development. And obviously what I'd like you to do here is think of, okay, could this possibly affect me in an intellectual way, an emotional way, and also a social way? Okay, so maybe she's very worried about this. This causes her to be anxious. She's very stressed. She can't concentrate. She feels a little bit helpless and doesn't know how to improve her situation. She has lower self-esteem. She's quite ashamed, quite embarrassed, doesn't perhaps want people to come to her property because of the condition of it, doesn't perhaps ask her friends to visit and things like that. Okay, so what I would like you to do on that question is think of your pies again, okay, and how you could apply this. I think intellectually, you could say perhaps that she finds it hard to concentrate. She perhaps doesn't have the necessary resources at home to help her educationally, or perhaps learning new skills for future employment. And then obviously there's a range of emotional things that we could talk about. And then socially, you could feel she feels quite lonely and quite isolated because of this current situation. Okay, so there's big scope there in terms of answers if we just think about structure before diving in. Okay. So the next topic tonight is how we approach different activities in different ways depending on our mindset. Okay, so I have obviously a colourful side to the brain and a perhaps dark side to the brain as well, and this is where I would look at the difference in terms of a fixed mindset compared to a growth mindset. Okay, so what we're looking for in individuals is that they have a growth mindset, okay, where they think that they can constantly improve and perhaps contribute in a better way to their lives and grow from their experiences, rather than a fixed mindset, which to me is a quite negative way of looking at life. Okay, so we're just going to start off with a fixed mindset. So these are your individuals perhaps that feel that intelligence and ability is fixed and it's not ever possible to improve or develop. So for example, you might have an individual in your class and they will be given a question and will say, I can't do this, it's too hard. I'll never be able to answer this, or I'm going to fail my GCSEs. Okay, so that is somebody who has a very fixed mindset, rather than perhaps seeing challenges as some way to improve their ability. Okay, now possibly somebody has a fixed mindset because they feel they have a lack of intelligence, okay, or they feel that they've inherited an ability which isn't perhaps particularly favourable. Okay, now obviously if they feel that way, to me it's completely incorrect, okay, because however challenging perhaps questions or problems are within life, we can always overcome those issues. Okay, and what we need to look at then is perhaps looking at those individuals and applying certain ways of thinking that will improve their perhaps self-esteem and self-worth, so they can think, well, actually, yeah, my mind and my ability and my intelligence can also improve if I put enough hard work in. Okay, so we're looking here then at growth mindset. So this is the belief that someone can learn and improve by way of constant culture of high expectations and quality feedback. Okay, so this is where somebody will grow because they're thriving for somebody to tell them where perhaps they could improve, and then they have high expectations of themselves because they've taken that feedback on board, and they want to learn and they want to improve to gain perhaps a better career or to improve their GCSE results. Okay. Obviously, this is quite useful within education and dealing with challenges and problems in life. So we could perhaps be doing a jigsaw at home and somebody would turn around and say, oh, it's impossible, I can't do this. While somebody else is looking at it and thinking, well, of course you can do it. There's several pieces that we need to put together and it'll take some time. However, this is possible. Okay, so there can be little things that contribute perhaps to your mindset in terms of previous experiences, how successful perhaps you've been, is there any purpose to it? But what we want is for people to be challenged, and obviously then they will be able to deal with problems that arise in day-to-day life in a far easier way than just giving up, or I can't improve because that's my makeup. Okay, it doesn't depend on effort solely. Okay, obviously that we need to have some kind of problem-solving ability as well, and perhaps a little bit of patience. Perhaps we need to be in the right mindset or frame of mind to approach the challenges that we face. And certainly I can say that sometimes I'm faced with a problem, and at that time I can't deal with it. However, I can revisit maybe in an hour's time when I'm in the right headspace to be able to complete the task. Okay. The advantages to having a growth mindset are that you can cope with things in a better way in terms of how these problems arise in life. Perhaps then you can deal with yourself emotionally in a better way. And also it'll help you when you're transitioning from perhaps certain areas of your life stages. So for example, when I'm transitioning from a primary school into a secondary school, probably secondary school into college or university, and then also into jobs, and obviously in the future then when I'm transitioning perhaps into my new home or transitioning into a different job in a different department. Okay. So this slide hopefully will help you with the difference between fixed and growth mindset. Now the next slide is why. Why do we want a growth mindset to our emotional well-being? Okay. So this allows us to share and control our feelings in a less aggressive way. Okay. And because then we can perhaps deal with these issues that arise in a controlled manner, more self-esteem towards ourselves. Okay, it can help me with how I'm going to be feeling in the future, in terms of, right, I've dealt with a really bad situation in a very good manner. This will help me definitely when perhaps I leave to go to university, for example. Okay. It will allow me to deal with life challenges and make the most of my opportunities, and perhaps be very grateful for where I am at the moment. I'll be less likely, to experience anxiety and depression in the future. And also, I'm likely to have more resilience. So when times get really difficult and I feel that perhaps I'm under a lot of pressure, and because of the way that my mind is allowing me to perhaps see things and gain positive feedback from prior experiences, then I will then continue to progress. Okay. We are going to cover resilience tonight as well, in terms of what is resilience and why is resilience important, because obviously this is connected with growth mindset. But what we're going to look at next is mindfulness, and how our mindfulness can help perhaps our mindset. Okay. So what is mindfulness? Okay, so mindfulness is something where you need to pay attention to perhaps the present moment and control your thinking process, and only concentrate on what is currently happening to you. So you could be in a situation in your life where you're trying to juggle several things and they're affecting your ability to make decisions. Mindfulness allows you just to concentrate on the present moment, and that is very important. Okay. This will help individuals then to understand their own thoughts and feelings and the world around them. So we'll just take time out to actually understand how we're feeling and why we're feeling like this at this present moment, just for me to gather my thoughts and feelings together. Okay. It allows our body perhaps to connect with our mind. Okay. And then because we have more control over our mind, we can better manage our feelings and our mental health. Okay. It also helps individuals to feel more positive and empowered, because they can control where they are right now. If they did not perhaps understand or practice mindfulness, then they would become overwhelmed with perhaps a variety of tasks or problems that they have on their plate. Okay, so this is more about how I'm going to deal with these problems and concentrate on perhaps the most important aspect at that time. Okay. Mindfulness will obviously avoid many mental illnesses like stress, depression, and addictive behaviour. And the idea is, like I said, we just take time out to concentrate on ourselves. Okay, so you're probably thinking to me now, well, how would I continue, or how would I begin with mindfulness, and what are the strategies perhaps that I can use. Okay, so with mindfulness we have what we would call our formal strategies. Okay, so here perhaps we meditate and we concentrate on our breathing techniques, perhaps reading books, we have sound resources, and perhaps we have a mindfulness coach or somebody that would just be there in terms of, right, I understand how you're feeling and now we need to get this under control. Okay, and perhaps you attend sessions on a regular basis to be able to learn these techniques, and then you can continue your mindfulness then as an individual and obviously use this when you feel appropriate. Okay. There are also some informal ways that we could learn mindfulness, and these could be very simple ideas in terms of we go to meet our friends, we have a balance between our work and our social life, and maybe we just go for a walk and we eat healthily. Okay, so the idea being behind these ideas is that it makes you just gain that control and actually concentrate on your present situation. Okay, now perhaps what we are very guilty of is not giving ourselves enough time to practice our mindfulness. Maybe during COVID you can remember situations with your teachers where they did a breathing session with you. Okay, and it's these things that we need to take more ownership of and ensure that as individuals that we complete these, just so that we can deal with our situations in life in a far better manner. Okay. So active participation, okay, this is a question that was asked in the summer last year in terms of what is active participation and how can active participation help individuals. Okay, so here we have a definition of active participation. Okay, so would you right now feel comfortable in terms of defining this? And then also Jack tries to keep himself healthy at all times. Explain the benefits to Jack of his active participation in decision relating to his health and well-being. Okay, so the next two slides are going to help us with our understanding of active participation, and then we will revisit this question. Okay, so active participation, it is not to do with participating in sports. Okay, now I've seen this several times where people think that active participation is, oh, I'm a sporty individual and I play for my football team. Okay, what we must understand from active participation is it's a way that we work where we are an active person in our own care. So we can contribute to our decisions, to perhaps the type of service, the individual that actually treats me, and where the service is. And I have control and I feel empowered because I'm an active partner or an active person in my care, rather than someone that's just sitting there and being told, right, you need to go and do this, you need to attend at this time. Okay, possibly there I could say, well, that is not convenient. Is it possible for me to attend on a different day? Is it possible for me to be seen by this individual? And I have a control over what happens to me. Okay, so please, 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 can you take that on board? Okay, it's not to do with participating in recreational physical education. Okay, so this helps us recognise that each individual has a right to participate in the activities and relationships of everyday life as independently as possible. Okay, so when I say in the activities, those activities could be maybe, right, I'm going to attend a physio session today. I would like to decide on perhaps not so much what I'm going to be doing, but in what order I'm doing those exercises. So I feel that I'm being independent and I have control. It's happening in my care. Okay, so this allows us to receive support and encouragement to participate actively. Okay, rather than just being that individual that's just sat there and being told what to do. Okay, We can take ownership of our development and well-being. Maybe we have an area of our development that we're not particularly happy with at the moment, and we can flag that up, and then care can be prioritised then dependent on where I feel there's perhaps a weakness at that present time. Okay. This is possible in each life stage. Okay, obviously, in terms of how an individual becomes empowered and makes decisions is very different to maybe a child compared to an adult, especially when they don't have much maybe social skills or can actually speak. However, we can then look at maybe images. Can they point at images? Can they express their decisions to us in an easy manner? Okay, why? Because we want them to be involved in the decision making of the care that happens to them. Okay. So there are advantages of active participations in general, and this is what we're going to look at now. And then we'll look at what are the advantages to children and young people and then adults. Okay, so the main advantages of being actively involved in my care, okay, and actually contributing to it. There are 7 areas, okay, and I've put these into a simple code called BOM, okay, you could reverse it and call it BOM MOP, it doesn't make no difference at all, okay. Why? Because I feel that I have more, so M for the first MOP, okay, more independence and control, okay. I feel that I have opportunities to give my opinion and to use my voice to help with decision making. I feel that I have possibly can have physical advantages here. Maybe I am more active because I said I'd like to go out for a walk every morning, and there could be physical advantage in terms of the food that I eat is healthier because I've been given a choice of what I would like to eat rather than just be given that food. Okay, so this is where the MOP comes in, and then obviously we've got the BOM next, which is better social connection, interactions and relationships. Maybe I've asked within my care home, can I possibly sit after lunch in a certain area of the room so I can speak to Mrs. Jones next door. Okay, and there's just these small decisions that can help us feel so much better in ourselves. Possibly there's more opportunity then to learn, develop skills, understand information, perhaps education and opportunities. Maybe as an adult who perhaps has suffered from abuse, I've never actually had an opportunity to study or maybe look at a career for myself, so I would like to get some qualifications on board, and I've never ever had the opportunity to express that in previous care that I've had. Okay. I can be more actively involved, obviously, in the participation aspect of it, and then I have better self-awareness because people are actually listening to me. I'm perhaps feeling a little bit better within myself, okay, and I'm also aware of my strengths and my weaknesses. Okay, I've concentrated on this today, and this is something that I feel that I haven't developed as well as something else. Okay. I also have better well-being. Okay, I have more respect and confidence within myself because people are actually listening to my voice rather than me just being somebody that's very, very passive. Okay, so these advantages are for any individuals. Okay, they're the general advantages of active participation, and now we're just going to look at the advantages to children and young people. Okay, so some of these are similar. I haven't got a code that I've developed for these. If you'd like to do that, obviously, then you can do that in your own time, depending on the access you get to the slides then after today. So we can develop our independence and responsibility. Okay, maybe I need to make choices myself in terms of how much screen time I have. Okay, so there I am independent, and there I am being responsible in terms of, okay, I'm going to limit myself today just to that 30 minutes on the screen. Okay, I can have more self-respect because I am making good decisions. Okay, I've been perhaps advised on and or supported on how to make effective decisions, and I have more self-respect because of that. My communication and cooperation with other people improves because I feel that they are also looking out for my needs rather than perhaps making decisions that's best for that care service themselves. I'm more motivated because the targets are very appropriate to me. Okay, I'm enjoying what I'm doing. I'm actively involved in what I'm doing, so I'm perhaps have more energy to throw at these activities. My relationships with others are better. Okay, I develop better leadership skills, and also I have a feeling of belonging once and for all because my voice is actually being listened to. Okay, and then advantages that just are specific to adults. I feel more in control. Okay, I have perhaps more dignity. So maybe I am an elderly lady who needs care with bathing and washing on a daily basis. I've made a request for me to be just supported by a female member of staff. Okay, and that happens. So perhaps I feel just a little bit more dignity towards myself just because they've listened to the decision that I've made there. Okay, I could have better connection with others in the community. So I've sat now next door to Mrs. Jones after I've received my food at lunchtime, and I feel better engaged with others. Okay. I can again be more physically active. Okay, have more self-respect, more independence, self-worth. And also this develops our relationships with perhaps professionals who work with us, okay, or maybe then friends and people perhaps who live in the same care home. It obviously depends on the situation, but your relationships are positive because you're feeling a lot happier with how you're being treated and how involved you are in your care, okay. Unfortunately, there are some barriers to active participation. Okay, so if we looked at cultural barriers, so maybe the activities that we can offer, the food that's on the menu, and maybe because of perhaps certain dates and celebrations that individuals can't always be as actively involved as others. Maybe there are physical barriers in terms of a service is provided in a location where perhaps there are no ramps, lifts, so I'm a little bit perhaps more restricted to the decisions that I can make. Intellectual barriers is a good one, okay, because of lack of perhaps understanding. Maybe the communication method that's being used is an unsuitable one in terms of the content, okay, and maybe the content is something that a child couldn't understand, so we haven't made it in a simplistic form to them, okay. There are emotional barriers. Some perhaps feel quite low in themselves, they have poor self-esteem, and they've never perhaps been looked at as a active individual before, and they find it a little bit uneasy to make decisions about themselves or to be involved in the care package. Social barriers, okay, maybe I don't have a very good relationship with others, they don't really know me very well, and they're not perhaps understanding me as an individual, okay, and I don't have much connection with them there, okay. So I very much appreciate that is a lot of information, okay, but the hope is now that we can return to this question and feel a little bit more confident, okay. So active participation in terms of defining this then would be that you are an individual, okay, you're an individual who is an active partner in their own care rather than a passive recipient. Okay, that would be my definition of active participation. Okay, as I say it once more, an individual is an active partner or an active person in their own care rather than a passive recipient. Okay, so that would then get you the 2 marks for your definition of an active participant. Okay, so Jack tries to keep himself healthy at all times. Explain the benefits to Jack of his active participation in decisions relating to his health and well-being. Okay, so here you could look at that he has more control. Okay, he feels that he is empowered because he's making this choice of looking after himself in a healthy way at all times. He probably has an opportunity to socialize here, okay, so if he's keeping himself healthy at all times, this could be healthy in terms of I attend maybe swimming sessions, I attend Maybe I go for a walk with my friends on the weekend. Okay. You could also say that he has more independence because he has this control himself. He has more resilience because he's able to deal with problems that occur perhaps in terms of his decision making, and perhaps how they're not always as effective as he'd like them to be, and how then he can improve that situation. He feels then he has more respect and confidence within himself because he is controlling this and he's contributing in a positive way. And then also he has more motivation to participate in perhaps further decisions that are involved in his care because he's been successful in terms of keeping himself healthy at all times. Okay. One area that I've not touched on tonight is resilience. Okay, I was hoping to get through another 2 slides, but unfortunately we've run out of time. So what I'll ensure that I do next week is begin on the resilience, so we can understand what is resilience and why resilience is so important to us. Okay, but just like I said at the beginning of the session, have a look at the WJC Health and Social Care website for the release of information for the higher tariff marks for the GCSE examination in May. Okay, that's all for tonight. Thank you very much for your time. I'll see you next week.